do we think that thinking about primary care as a common good, beginning to talk about it that way, really with the lens of equity, I think in particular, kind of could really push forward this conversation about what do we expect in our communities? Do we expect every single person to be able to have access to primary care as a common good? And then what do you think, what do you think that might do to to the way in which we engage in the conversation about primary care? Again, thinking about primary care sort of writ large. Do you see primary care as a common good or a social good? So I think we'll start with Dr. Wong, and then we'll be able to end with the words from Shelina.
Well, I think certainly right now, primary care is more seen as an economic good rather than a social good. And there is no question that the system now is broken, right? We've got high and growing costs. We certainly have relatively poor outcomes when we compare ourselves to other countries that spend much less than we do on healthcare writ large, but certainly have very strong primary care systems. And when you have our health system as it's set up now with primary care and the rest of healthcare as this economic good, you just get this, like, as I mentioned before, super complicated system. People are very confused about what services they can get, no idea how much it's going to cost them, sometimes certainly leading to people choosing to not seek care because they are worried that it's going to be costly, because it often is. I think when you think about health, primary care as a social good, because certainly thinking about it as an economic good is not working for us. I think, you can certainly look to some of our other countries that have more arranged their system with primary care and healthcare as that sort of social good. I'm thinking of places like the UK and Scandinavia. And certainly when you're looking at the types of outcomes that we want, right, the better health outcomes at a lower cost rate, achieving this concept of value, you do see in these countries that they've got better ratios when you look at that value equation than we do in the US. Now, not to say that's all a panacea either. Obviously, there are things that they are trying to also reform and transform within their own healthcare systems. And again, COVID has brought to light things that were working and not working in their systems, as it did for our system here in the United States. But at a bare minimum, I can say that treating primary care as an economic good is not working. And so we need to do something different.
Oh, great. Well, thank you. Last words from you, Shelina. What do you think?
Completely agree with Charlene. And I think philosophically, I truly believe primary care is a common good. I think, and I'm going to put a spin on value-based, we must start treating every human being as a valuable human being. And then if we actually truly were honest about that, then we would actually start seeing improved health outcomes. And I feel like then everybody would believe it wouldn't be an economic good for primary care, but it would really be us thinking of primary care as a social good when we start treating every single human being as a human being and valuing them truly. In I know not the definition of value-based care, but in terms of how we value each other as humanity.